Assalamu alaikum. My name is Rafeda Hassan Shah and I'm the president of the Student Research Committee of Khyber Medical College, Peshawar.
And my name is Asad Rahman Khattak. I'm the Director Activities, Student Research Committee, Khyber Medical College. We'd like to start today's webinar in the name of Allah, the most beneficent, the most merciful, with the recitation of the Holy Quran. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. صدق الله العظيم.
I'd like to take this opportunity to talk a little bit about our mission with the Student Research Committee. We founded this committee to introduce students to the opportunities awaiting them in the world of research and to help our students who are already interested in research and who are seeking research opportunities in any way we can. And we also aim to build a platform with which students from different colleges can coordinate with each other on research topics.
For today's webinar, we're delighted to have 3 guest speakers. Each speaker will talk for about 10 to 15 minutes and present about the topic that has been assigned to them. Their presentation will be followed by a 5-minute question-answer session. All those in attendance, please note that if you would like to ask a question, if you'd like to ask the speakers a question at the end of their presentation, please type in your question and post it in the comments of our YouTube live broadcast. You would need to have logged into your YouTube account to post a comment, so please do that now if you haven't already.
Now, moving on to the people everyone is here for, I'd like to introduce our first speaker, Dr. Masoor Kadir, joining us all the way from Khan University to talk to us about the very important topic of why medical students should be interested in research.
Our second speaker is Dr. Iqbal Haider, Associate Professor, Department of Medicine, Khyber Teaching Hospital, Peshawar. He'll be talking to us about evidence-based learning.
Our third speaker for today is Adil Hamid Khan, the Vice President of the Student Research Committee, and he will be speaking on the topic of creating a successful research culture.
All those in attendance, please note that we will be sending participation certificates online. For that, we will send an email with a link to Google Form to the email addresses that you registered with. Please note that this will be done at the end of the webinar, and you will only have 15 minutes after the webinar has finished to submit your forms and ensure that you get your certificate of participation.
Now, I'd like to welcome our first speaker, Dr. Masoor Kadir. And let me just take this opportunity to tell you how lucky we are to have him with us today. Not only is he the chairperson of the Department of Community Medicine of Khan University, but he also has immense and invaluable research experience. Welcome, Dr. Masood.
Ask Dr. Masood, where is he? There's a technical difficulty. I don't think Dr. Masood is here yet. I think he is rebooting his laptop, so I think he'll be here in 2 minutes, we've been told. So how about, Rafeda, you tell me a little bit about the Student Research Committee as we wait for Dr. Iqbal Haider.
We've established this committee for the purpose of building a research culture in Khyber Medical College. And we hope that with the webinars and the seminars we organize, we introduce students to the world of research and let them know how invaluable it is for your CV and for your future life, as well as to be a good doctor. You cannot make a good doctor without a good researcher. And we also hope that you can all coordinate with each other. All right, Dr. Masood is here. Welcome, Dr. Masood. You have the stage.
Assalamu alaikum. Can you hear me clearly?
Yes, sir.
Okay. So, whenever you want me to begin, just let me know.
So you may begin.
Okay.
Thank you, sir.
Thank you, sir.
Okay. Assalamu alaikum, everyone. I hope you can hear me clearly. When I was asked to talk in this session, and the topic was scope of research in medical field, I started wondering, this is coming from students. So when we were a student, we never thought of research. So when Rafada asked for the topic, I thought, why not start by a question? And that is, why should undergraduate medical students learn research methods? So when you start thinking about it, the one obvious answer suddenly comes to your mind is because they're going to do research in future. So now think for a minute that how many of you would actually do research in your careers? If I give you an option, let's say more than 75%, more than 50%, maybe more than 25%. So if you look in reality, it's not that much. It's very few people. Most of us, or most of the medical practitioners go into private practice. So then why bother about research? So this question comes in. So take another scenario and see when a patient comes to you, and everybody has nowadays this, right? So डॉक्टर साहब मुझे खांसी और सांस में तकलीफ हो रही है, क्या मुझे कोविड हो रहा है? Now, how are you going to answer to that unless you really know what's the fact? And to know what's the fact, the first thing you need to know is the fact what is narrated in different search engines, are they valid? And when you want to know what is valid, then you need to know whether the research that was conducted was robust enough that you can rely on that information. So that is one key reason that even if you're doing private practice, you will have to understand what research is, what information is, where to get the information from, and how valid is that information. And on top of that, in your particular scenario, whether that is applicable. So, I mean, that also becomes very important. A lot of time you hear this that, oh, because we are doing this research because no data is available in Pakistan. But is it relevant to get the data for Pakistan, or you can work with the data that is already available? So then if you just rely on textbooks, if you think about textbooks, how old is the information in textbook? One in every 10 years old. It takes 5 years to get a good edition of a good textbook like Davidson or Harrison, and then the information that they gather is old. By the time it gets to you, a lot of things have happened. So if you start about research, starting right from a patient comes with sign and symptoms, to diagnosis, to treatment, to complications, every information is coming from research. And you need to be clear on how things are. I'll give you some examples. So nowadays for COVID, we are doing PCR test, We are doing rapid PCR test. We are doing, rapid antigen test. So how, if a patient comes with a positive PCR test versus a positive, antigen test, which one would you trust? And what are you going to tell the patient? कि आपको COVID है या नहीं है? Where are you going to get that information from? So that is coming from your sensitivity and specificity. And that you look at every test, every diagnosis. Let's say you diagnose diabetes. So the cutoff has come down now for fasting blood sugar level. For that matter, now we use A1C. So where does that come from? And is it true for our population as well? So that's the kind of thing that you have to look at. Then obviously treatment. So many new modalities are coming in. I'm just using COVID as an example because things are quite new over here. So there are several treatments have been suggested. How effective are they? So if you start reading about it, probably currently hardly any treatment is available. Hopefully, inshallah, in future, this is going to happen. My hope is that in this century, last century, there were antibiotics that were discovered against bacteria, but this century probably something is going to come, and it's going to come hopefully in near future as to how to treat viruses, which are the difficult ones to do. So, what about some new avenues in research, in medical research? So traditionally, I'm sure you're all familiar with epidemiology, biostatistics. These are quantitative methods, but then you probably may be familiar with the qualitative methods. So qualitative is more to do with most of it is how do people behave. Um, why is it that people are not going to a particular healthcare provider, or why they are going to a particular healthcare provider? For example, questions like that. And a lot of times now in human health research, one has to use mixed method, which is a combination of both qualitative and quantitative. So you need to understand these as well. Now there's another term you may be familiar with, and that is artificial intelligence. How is it affecting medical research? How is it used in medical research? So now this artificial intelligence, if you look at some of the examples, it is mostly to do with data sciences and huge data sets. Let's say one of my students is looking at, a graduate student is looking at chest x-rays of patients with chest trauma and trying to see whether through artificial intelligence can one diagnose that lung has been affected. Obvious things do come up, but minor things may not be detected. Why is this important? So when you are in ER or emergency room and you have to make quick decisions, you can't wait for the reading of the radiologist, which might take a couple of hours. So can you put up an X-ray, or nowadays, you get it directly on your screen, and whether the algorithms can tell you, well, this is chest trauma, it has affected lung, the patient will need something different than something simple in terms of management. It has also been used in, let's say, in diagnosing benign from malignant skin tumors. There's an example on that. Then another thing that is coming up, and by the time you are going to be practitioners, I think it would be much in vogue, would be this research in stem cell research. Regenerative research, when new cells are generated from the basic cells and then the daughter cells, and then whether they could be harnessed into or developed into specialized cells like the tissue cells, treating diabetes, treating cancers, etc. So probably you have to learn all this. Now, I think I would be running out of time, so I'll take another 1 minute and add it up with one thing more. So we deal with human beings, and one person does not behave the same as another person. So that means we have to understand how people behave. It is coming right from behind in terms of centuries, generations, customs. so social setting around us. So that kind of research is top up to whatever you know scientifically in a more hardcore way. The same kind of patient, two patients with similar complaints, same treatment required, one would follow your guidelines, other would not. So why is that happening? So as a group, why are people not going and getting vaccinated against COVID? For that matter, in some communities, why are parents reluctant the child should get polio vaccine? So that understanding comes mostly from qualitative research. So in your own environment, when you sit as clinicians, unless you understand what to do and where the information and the knowledge is coming from and how valid it is, probably you would lose in terms of being ahead of the game. So I'll stop over here. I know it's a bit broad, but maybe I've run out of time now. So we'll open up to question and answers.
I think we're ready to ask him a few questions.
So we have a few questions from our audience members.
Yeah. Sir, can you hear us clearly?
Yeah, a bit louder would be helpful.
Okay, we'll try to be loud. So we have a couple of questions for you. Let me just read this out.
So the research criteria is so difficult, that's why most people are reluctant. Do you think it's going to change in the near future?
So isn't clinical practice difficult?
That's true.
It's just, I mean, research is just one part. That's what I said, that it's not that most of the people or even medical student, I think hardly 10% go into pure research, or even clinicians who get into research. A lot of time, you may be participating in research in terms of, अच्छा जी मेरे patient हैं, तो इसका data आप ले लें. But that's not research, Somebody else is doing it. What you need to know is, whatever information you get, at least you have a sense of whether what is valid, what is not. The other thing is, you have dwelt, if you ended up into medical school. Now you look at your colleagues from high school who are into other fields, and you tell me who is studying more. हमारी तो जिंदगी खत्म हो जाती है ना. मेडिकल कॉलेज में आओ, किताबें पढ़ो, और घर वाले कहते हैं यार किसी की शादी में नहीं जाते हो, फैमिली आपको पहचानती नहीं है. By the time in 5 years, so that's the kind of thing. I hope that answers your question. You need to have a passion to do something.
So we have another question as well. Do we have another question? So, give me the question. Any question. Okay, sir. The other question is, so we have another question. It says, as doctors, how does having a research background impact our careers? I know you spoke about that, so if you could elaborate a little bit more for our viewers, that'd be well appreciated.
You see, you can view it in two different ways. One is, most of doctors in every field are into private practice mostly, or even if they are into some hospital, they have their own practice. In Pakistan also, and that's across the board globally. Okay. Some people are into the academic fields, that is, they are into medical colleges or into research organizations, where their career depends on the research and the research output. In terms of clinicians, as I've already explained, the research knowledge helps you in making proper decisions and valid decisions, which, if you do correctly, you're going to be successful. As simple as that. So that's how it's going to help you. तो ये नहीं है ना कि फेसबुक से कोई इन्फॉर्मेशन उठा लिया और उसको अप्लाई करना शुरू कर दिया. You don't know, I mean, whether that information is valid or not.
Okay, so those are the questions we had for you. Okay, I'm being told we have one other question. Sorry to keep you, sir. So it's kind of a follow-up on when they talked about the criteria. I guess it's a follow-up comment on that. So if you could shed some light on that. It says, sir, in clinical practice, you see immediate results of your knowledge. That's what gives you happiness. But when compared to research side, it's quite the opposite. So if you could
So you
kind
please
of,
don't dissociate research from clinical practice. Clinicians also do research. So I mean, it is research that has resulted in robotic surgeries. This is research that has resulted in laparoscopic surgeries. So हमारे ज़माने में तो गॉल ब्लैडर निकालते थे, इतना बड़ा स्कार होता था. अब तो 2 होल होते हैं छोटे से. ये कहाँ से आए? It's come from research. So it's the other thing is probably the question should have been जो हमारी फील्ड से ज़्यादा रिलेटेड है पब्लिक हेल्थ से, कि आप जो काम करते हैं उसमें तो कोई इफेक्ट नज़र नहीं आता. पॉपुलेशन में आप 10,000 लोगों में 20,000 लोगों में काम कर रहे हो. हम तो ईआर में क्लिनिक में काम करते हैं, रोज़ की तब्दील मतलब कुछ ना कुछ फ़र्क नज़र आता है. हम तो पूरी ज़िंदगी गुजार देते हैं कि यार पूरी 10,000 की पॉपुलेशन में 2 मिलीमीटर मर्क्यूरी ब्लड प्रेशर कम हो जाए, कम भी नहीं हो जाए, मेंटेन हो जाए. You know what the effect of that 1 millimeter mercury difference makes in a 10,000 population? 10% reduction in occurrence of hypertension and cardiac diseases. We can't see that effect. But look at what you'll do in clinic, in life, and how many lives would you save as compared to a public health professional. दिखने के नज़र नहीं आता. Okay.
so basically you're saying that research and clinical practice, they may seem as separate entities, but they go hand in hand. Thank you so much, sir, for your time, for your invaluable session, and it was very informative. We really appreciate you being here. Thank you so much,
Thank
sir.
you very much. Thank you very much for inviting me. Good luck.
Thank you.
Thank you, sir.
So again, I spoke about this at the beginning, but for those who have joined us late, I will also say this again. I will say this again. Okay, all those in attendance, please note that we will be sending participation certificates online. For that, we'll send you links at the end of the seminar, the webinar. Secondly, if you want to ask questions from our next speaker, who is Dr. Iqbal Haider, please note that post comments on our YouTube live broadcast. We will read those and we will pick questions out for Dr. Iqbal Haider. Okay, so if you want to ask a question, again, I say please post a comment on our YouTube live broadcast. Thank you. And for that, you need to have logged into your account. So please do so if you haven't already, because without that, you can't post a comment.
Very good opportunity for everyone to ask questions from such experienced professionals.
So don't miss out on this opportunity. Moving on, I am pleased to introduce our next speaker, Dr. Iqbal Haider, Associate Professor, Department of Medicine, Khyber Teaching Hospital, Peshawar. Dr. Iqbal has over 20 years of experience in clinical practice, teaching, and research, with special interest in infectious diseases. The topic of Dr. Iqbal's presentation is evidence-based learning. Dr. Iqbal, the stage is yours.
Good evening and assalamu alaikum, everyone. Am I audible to everyone?
Yes, sir.
Yes, you are, sir.
Okay, first of all, thank you all, Rufaida, Asad, and everyone for giving me the opportunity to utilize your platform for this purpose. We are trying since long to inculcate the culture of research to our future doctors, which are, of course, our near and dear students. And thanks to Almighty Allah, that's the things are now on the right track. I will just present my presentation with the simple quote that whenever we are doing our round and the students are with us, I simply ask from my trainees, what is the evidence of using this medication? And I'm a great proponent of evidence-based medicine. So this will be a brief opportunity to have insight what is the evidence-based medicine. Um, my screen audible to everyone?
It is audible, but we're waiting for you to share your presentation.
Okay. So is it visible now?
Yes, sir.
Yes, sir.
It's perfectly visible.
Okay. So let's begin with the name of Almighty Allah, the most beneficial and proficient. The topic of today's presentation is evidence-based medicine. And you know me, I'm Dr. Iqbal Haider. So the brief learning objectives of this lecture, which is of course 10 to 15 minutes. So we will try to cover what actually evidence-based medicine is, what are the main components of evidence-based medicine, and how to apply a plan or an idea to inculcate evidence-based medicine in our practical life. These will be our main areas to which we will briefly have a focus on. So by definition, as per David Sackett said, evidence-based medicine is the integration of best available research evidence with clinical expertise and patient values. And this definition was given by David Sackett in almost 1975. So the concept of evidence-based medicine is not a new concept. With literature search, you can find it that it's almost a century old concept, although we are presenting it in this 2021, but even in the old books, even Arazi and they were of the view that always utilize the concept of expertise with the literature and utilize it in the best interest of the patient. So uh, these are the main components. As per Oxford Dictionary, explicit, judicious, and conscientious use of current best evidence from medical care research to make decisions about the medical care of individuals is labeled as evidence-based medicine. So, what actually is evidence-based medicine? It is the integration of clinical expertise of the physician with the best available research evidence at that time and the patient preferences and rights. Keeping all these together is evidence-based medicine. So why to apply evidence-based medicine into clinical decisions? Because it enhances the opportunity for optimum clinical outcomes and quality of life. So, what are the essential steps to practice evidence based medicine? Uh, the first and the utmost important is form a proper, pertinent, focused, and answerable question for a clinical scenario. Then, search effectively from the literature, which may be online or from the books or even from the gray literature, and then do the critical appraisal of that literature to find out the answer for that particular question. Integrate that evidence with clinical expertise and patient values, and then evaluate the whole process for the future guidelines and management of that particular scenario in future management of such patients so that we can learn from our efforts and from our expertise. So these are the 5 step approaches in the evidence-based medicine which you as a future doctor have to inculcate in your upcoming career. So what is then the process of evidence-based medicine? First and the utmost important is assess your patient and then ask relevant clinical question which is answerable. acquire the best available evidence at the time of your research, and then appraise the evidence and apply this evidence in the management of your patient, with particular emphasis on the patient preferences and patient values. So this is the whole process of evidence-based medicine which we as a physicians are applying. So how to formulate a clinical question? You all know the PICO, population, patient, and these are the few examples of patient or population. It may be a patient with acute MI, or a female with suspected coronary disease, or in postmenopausal woman. These may be your selected population or patient. In PICO, the second of abbreviation is for intervention or exposure. So when we are considering acute MI, does early treatment with a statin is a kind of intervention, while exercise echo accuracy is a kind of intervention for women with suspected coronary artery disease. While in postmenopausal women, you may consider HRT. In comparison, you can compare it with the placebo, with exercise ECG, or with no hormone replacement therapy. And outcome, definitely it may be a decrease in the cardiovascular mortality, in the diagnosis of the significant coronary artery disease, or the risk of breast cancer in those patients who are postmenopausal and who are taking hormonal replacement therapy. So these are a kind of PICO-based answerable questions. Then what is the level of evidence? Actually, this level of evidence is such a broad term which creates a lot of confusion in our clinical practice. This level of evidence may be on the basis of individual clinical expertise, or the best available external clinical evidence from systemic research. You all know that clinical expertise need a lot of skills, education, and on top of that, experience. So all these factors come into play, and then this vigilance of clinical expertise come into patient, the clinician mind. So there is no shortcut for clinical expertise in even in evidence-based medicine. Coming to the best available clinical evidence, it may be derived from research, which is maybe from the basic medical sciences, the therapeutic options, and of course the systemic reviews and meta-analysis. They are also options of best available clinical medicine. Coming to the evidence pyramid, you all know that when we are discussing the evidence-based medicine, there is a term of level of evidence which is expressed as pyramid. So the lowest evidence is those evidence which are given from expert opinion or case reports. On top of that is the single experimental or even case series studies, then descriptive studies, quasi-experimental studies, case control studies, cohort studies. Randomized clinical trial is a very good option for a lot of evidence-based medicine, although it's difficult to perform, but the weightage and level of evidence is at the higher hierarchy. And then on top of each evidence is randomized control trials along with systemic reviews, which may or may not be accompanied with the meta-analysis. So the tip of the pyramid is the highest evidence of at the level of evidence-based medicine, and we usually try to find out this kind of evidence for our patient management, but it's not possible in each and every scenario. So the practice of evidence-based medicine is to answer questions regarding the etiology of disorders, utility of diagnostic tests, effect of certain therapy in management, and of course prognosis of disease. But keep in mind, each and every step of evidence-based medicine always begin and always end with the patient as the center of focus. So, how to identify the best study? It depends on the type of the question. For therapy, of course, randomized control trial is the best study. For diagnosis, etiology, harm, prognosis, prevention, clinical exam, and cost, these are the uh, best type of studies, and you can see it that the level is then decreases as you go on the right side. So why is evidence-based medicine important? To be honest, each day new type of evidence are emerging and it creates changes in the practice-based medicine and the way we are treating our patients. So it actually affect our patient management care. But to be honest, as a physician, we don't have enough time. We have out updated textbooks, and top of them disorganization of the biomedical journals which are available to us. So these three are the main frame factors which affect our uh, um, um, efficiency as far as management is concerned. As per source of British Medical Journal, we as a physicians have less than 1 hour per week available to us for reading, while as a as an up-to-date journal medical specialist, we need at least 19 articles per day, 365 days per week. So this gives us an impression just like this: a physician always suffering from information overload and in a fatigue and an insomniac state. So how to overcome this problem? Evidence-based medicine is a good approach if we are uh, lifelong learner. Why then this sudden interest in evidence-based medicine? With the passage of time, we as a physicians have recognized that we are focusing too much on our clinical expertise, but the current level of knowledge we are lagging, and it deteriorates our clinical performance. So the need for valid information as far as diagnosis, therapy, prognosis, and prevention in this area of consumer activism is a main concern for all healthcare workers. And top of that, another problem which we all are now facing is that our patients, which are common men, they have access to a lot of medical literature through Google, and they have transformed themselves into a doctor Google. So they will always come to you and say, Doctor साहब आपने तो ये दवाई बताई है लेकिन इस दवाई के तो ये side effect है. So limited time availability to the clinician, and then on top of that access of common men to this knowledge uh, imposed us in this evidence-based medicine transformation for all of us. So what are the benefits of evidence-based medicine? It minimizes the errors in patient care. So diagnostic errors can be minimized if we apply this evidence-based medicine. The cost of treatment also is a major factor which can be minimized if we utilize the evidence-based medicine. The quality of patient care can be optimized. Skills learned in evidence-based medicine, or to be honest, they are the skills of lifelong self-directed learning. So there is nothing new skills in this. Just transform yourself into a self-directed learner, and on daily basis, if you approach to the literature, these things can be minimized, and things will be in normal position. So there are some misconceptions, myths, and facts about the evidence-based medicine. One big myth is evidence-based medicine is useless when there is no good evidence. बहुत से लोग आपको कहेंगे कि एविडेंस बेस्ड मेडिसिन का क्या फायदा जब हर चीज में कोई अच्छा एविडेंस ही अवेलेबल नहीं है. Keep in mind, evidence-based medicine focus on appropriately using the best available evidence at that time for the optimum care of the patient. So उसी टाइम पे जो बेस्ट अवेलेबल केयर मौजूद होगी वो मैनेजमेंट के लिए यूज होगी। और इसके लिए मैं अक्सर एक एग्जांपल देता हूँ कोविड सिनेरियो में। आप लोगों को याद होगा लास्ट ईयर HCQ का बड़ा एक बस चल रहा था कि HCQ के साथ मैनेज करते हैं। हमारे पास और कोई ऑप्शन नहीं थी, हमने भी HCQ लिख ली, लेकिन द मोमेंट हमें रियलाइज हो गया कि ये इट्स मोर हार्म देन प्रेजेंट गुड, सो वी स्टॉप दैट प्रैक्टिस। सो एविडेंस बेस्ड एक फ्लेक्सिबल अप्रोच है, इसमें आप अपने आप को मोल्ड कर सकते हैं। अनदर मिथ इज that evidence-based medicine is a simple algorithm that ignores clinical judgment and expertise. I've already told you that clinical judgment and expertise is one of the three basic pillars of clinical evidence-based medicine. So clinical judgment और आप एक्सपर्टीज के बेस पे आगे जा रहे होते हैं और उसको प्रॉपरली यूटिलाइज कर रहे होते हैं। Evidence-based medicine is just a number and a game of statistics. It's another myth. It's not a number in vacuum. The evidence must be individualized to each patient. तो आप हर एक एविडेंस बेस्ड मेडिसिन में जब भी आप किसी पेशेंट को ये अप्लाई कर रहे हो तो आप एक पेशेंट स्पेसिफिक अप्रोच अप्लाई कर रहे होते। इस तरह नहीं है कि एक जनरलाइज्ड अप्रोच सब पेशेंट्स के लिए होती। ईच पेशेंट इज इंडिविजुअलाइज्ड एज फार एज इट्स मैनेजमेंट इज कंसर्न्ड। I'm when we are confronting with evidence-based medicine, we will encounter this class, which is basically a strength of recommendation. This strength of recommendation may be in the form of strong recommendation, moderate recommendation, weak recommendation, or in the form of no harm or no benefit. So ये class वाली definitions के लिए use. There is another classification which is basically on the level of evidence, which is the quality of evidence. Level A, I already told you, इसमें meta analysis और randomized controlled trials आ रहे हैं। और सबसे जो वीकेंड होते हैं वो एक्सपर्ट ओपिनियंस होते हैं, वो लेवल सी में आ रहे होते हैं। ग्रेड्स ऑफ रिकमेंडेशन ऑफ कोर्स ये भी एक क्लासिफिकेशन है जिसमें हम मेटा एनालिसिस को टॉप में रख लेते हैं और इसी तरह फिर बेस लाइन में वीकेंड एविडेंस को रख रहे होते हैं। बट आई विल नॉट गो इनटू डिटेल ऑफ दिस classification because it may be a level of confusion for you, so we can discuss it in detail in future whenever we are discussing this evidence based medicine in detail. So, clinical practice as a physician, we encountered patients with diseases and we have a variety of treatment options. And the outcome is always in the form of either success or failure. But evidence based medicine gives us another avenue of opportunity. This opportunity for this opportunity is for change and opportunity for better treatment. So keep in mind that always there is some other problems with the evidence-based medicine and these are the potential pitfalls। जब भी आप किसी स्टडी को या एविडेंस को वेट कर रहे हो तो उन pitfalls को आपने अवॉइड करना है। and these pitfalls may be in the results and conclusion which may be, आप अगर याद रखें तो बहुत सी स्टडीज के कंक्लूजन में प्रॉब्लम्स आ रही होती है and these problems may be in the shape of fabricated results or the conclusion may be from the small study which cannot be generalized to a large study. Methodology में भी problems हो सकती है। if you use the wrong technique of methodology then the study can be improper technique. Data analysis, improper statistical analysis can also lead to abnormal um, results. So इन pitfalls को आप हमेशा अपने माइंड में रखना है और ये एविडेंस को वीकन कर रहे होते हैं। I'm giving you a simple example, but I think so I have completed my time, so I leave this example and just coming to the take away message. The simple takeaway message from the evidence-based medicine is that medicine is not exact science. It is a science of probability, and the physician have to be with the maximum up-to-date level of knowledge and medical care, and you have to help your patient to live long, functional, and pain-free life. So, by adopting these principles of evidence-based medicine, you can optimize the quality of patient care. And we, as a medical educationists and medical colleges, have to inculcate the principles of evidence-based medicine as a concept, as a philosophy, and as a religion, so that our future doctors can inculcate these skills in their ongoing and future level of training. Thank you so much.
Thank you so much, Dr. Iqbal, for your time. This is a wonderful presentation. You talked about how there needs to be an integration of expertise with research evidence, and the goal of this is to get an optimum outcome when it comes to the patients, and you need to ask questions that need to be addressed and relevant questions. So this was a wonderful session. We have two questions, follow-up questions for you. Rafat, if you mind asking
So
the
the
first
first
question.
question is, can you explain why doctors in Pakistan in general do not follow the evidence-based learning, evidence-based medicine model, and instead they prefer to follow the traditional model?
बेटा एविडेंस बेस्ड मेडिसिन इट्स नॉट ए सिंगल स्टेप के आज आप ट्रांसफॉर्म हो जाएगी. इट्स ए कल्चर. रिसर्च और एविडेंस के लिए आपको एक कल्चर डेवलप करना पड़ता है. आपके अपने एक स्किल्स होती है. आप उस स्किल्स में एटीट्यूड में एंटर हो जाती है, एंड देन इट बिकम्स ए inheritance of your trait and characters, personality. Giving you my own example, you have to study at least 3 articles per day, which is not a simple job if you have to be up to date, and sometimes it becomes very cumbersome. Even your family, your students, they get bored of you. What kind of person this is, always sending articles and presentations and talking about articles. So you have to inculcate and you have to prioritize your uh, preferences. Me as a physician or you as a doctor, it's our prime responsibility to inculcate these characteristics in our personalities. In this way, we can move forward. Otherwise, traditionally, if I say I said it this and you have to follow like this is an expertise or doctoral approach in medicine, which the days have gone. We have moved forward, and the things are not in the same shape. And all even our curriculum of medical education is now in dynamic phase. The patio learning phase of lectures has gone, and we have transformed ourselves into this small group discussion, critical learning, evidence-based medicine. So the old concept, I don't think so. We can't be stagnant into it old concept. We have to move forward.
Right.
Thank you so much for
Thank you
giving
so
us your
much. So,
valuable
yeah.
time.
So basically, before we wrap it up, basically you're saying that the culture needs to change and we need to find a paradigm shift, a dynamic shift, and that's how we will achieve this goal and of evidence-based learning. So thank you so much for this very important and valuable session.
Very
And
pertinent topic.
exactly, and for your valuable time, sir. We really appreciate it. We really appreciate that you could join us. Thank you so much, sir.
Thank you all for giving me the opportunity. Thank you, Sir Mahmood Aurangzeb Saab, for giving us this platform. And I wish that this activity will carry on and it will be a first drop of this huge storm of knowledge which we can share with our juniors. And me and my team, we are always ready to be with you. So this is a new horizon, and let's explore it and find a new height in this thing. God bless you all. Khuda Hafiz.
Exactly. When we are, if we'll be joined by insightful people like you, inshallah, it will be an easy task. Thank you so much, sir. Now we receive news. It's kind of a treat for us and for everybody. We are going to be joined by the Dean of Khyber Medical College, Dr. Mahmood Aurangzeb, who is the head of surgery department at KTH. All of this was made possible due to his engagement and his support. Let me just tell you that this is the first time that Khyber Medical College has its own research society, its own independent student research society, which would not have been possible without Dr. Mahmood Aurangzeb. So, sir, we really appreciate you and we thank you for all your efforts and for making this possible. And we also appreciate you that you could join us. So, if you would like to say a few words, please. Sir, please unmute your mic.
Right, I think you can hear me now.
We can hear you clearly, sir. We can hear you loud
Right.
and clear.
All right. Now, I've been listening to the presentation, and people like Dr. Iqbal Haider, Dr. Farooq, and so many of you are really my eyes and ears and my arms and legs. Um, and I do want to bring in with me in my period as dean and inculcate this culture of research into the students. Now, what happened, my own journey was such that we went through this very old didactic form of learning and teaching at Khyber Medical. And immediately after my house job, obviously, I embarked on some sort of specialist career. And I was slammed with the PLAB test and the Part 1 FRCS, which were nothing but MCQs, something which was totally alien to us. It was not introduced at any level. And it was at that point that I realized that what are we doing with our medical education? We are just stuck in time. So first of all, I entered into an examination system which was completely new to me. So I always felt the need that we need to whip our medical institutes into action to keep at par with international standards. Otherwise, we'll be left far, far behind. Now, as Dr. Iqbal Haider mentioned, that we are going through a transition right now, and the curriculum is being modified into an integrated and a modular one, horizontally and vertically, and hopefully in a year or two, this shall transcend the whole way. We are going in the opposite direction, starting with first year, second year, third year, but hopefully fourth year and final year will be integrated as well. When I was a student, unfortunately, we were taught in total isolation. One teacher did not know what the other one was teaching, and so we had to put things together ourselves. The second, so that is underway, and hopefully, in my time as dean, we should be able to achieve that. The other thing that I feel is most important, and that is research at student level. Now, recently I met with Dr. Zulfikar Bhutta, who is one of our great alumnus. He's on the Prime Minister's Task Force for Health Reforms, and he's a famous consultant at Aga Khan and in Toronto, and divides his time between Pakistan and Canada. I hosted him for lunch at KMC recently, and obviously, when I get hold of these people, they shy away because they think that Mahmood is after us for financial support and things like that. That I don't worry about because the government is quite generous with me and has been. The chief minister is from my home district, and the health minister and the finance minister, I've reached out to them, have been most forthcoming. Now, the problem is I needed support in terms of research at student level. This morning, Dr. Farooq met with me and told me that he's planning to introduce a journal of student uh, medical research, which will be the first in Pakistan. So, if we can be in the vanguard of such an activity, I think that it'll be to our credit. The other thing Dr. Zulfikar Bhutta told me is that he himself is a researcher and a PhD, and very keen on medical educations and always been very enthusiastic about it. And he was telling me about his own life story, that he did a bit of research as a student, and that really was the catalyst for him to pursue such a line in future. Now, when I was in England and starting training about 35 years back, every job that I applied to, the first question that I used to be confronted with is, what research have you done? And I thought that that was totally outlandish. I don't know what this person is talking about. So, just to tell you that if you are going to, even the primary job that you apply for in the West today, they will expect some degree of research. So, if it's done at a student level, it will allay the anxiety and the fears of what research is. So, I want to thank the entire team, Dr. Bushra, who's our associate dean for research, that I said the first thing you must do is inculcate this culture into our students. And I think we are slowly getting there, slowly but surely. That is all that I can say. I thank you all for organizing this event today. And I was definitely going to be a participant in it and shall continue to. And you will realize um, in the years henceforth that how important this is, and this will put you, like I said, head and shoulders above other people. So thank you, Dr. Iqbal Haider. You're always available there to me. In the meantime, Dr. Zulfikar Bhutta has promised to get us international funding for our student research. So I'm reminding him practically every 24 hours, and inshallah that will come through, so that there is some sort of a reward for people, young students that do take time off to do research. One last thing I would like to tell you is that when I was a medical student, one of somebody from SWAT, a very nice lady who was a professor of nephrology in Chicago, she subscribed a journal to me, the very famous New England Journal of of Medicine, and that used to be published every week. And I had stacks and stacks and piles of those journals. And now I realize, because what she wanted me to do is to move away from the traditional learning from textbooks and to try and understand reading journals. That it's not rocket science, it's nothing impossible. And I realized that I just threw away all those journals, and now I feel that was a mistake. So that must not happen with our young, enthusiastic students. As you know, Khyber students are, you know, a world apart from the rest. I will be open in saying that. So I feel that I want to add to your credentials, and your credentials will be stronger once you have some research paper on your CV. Thank you very much for your kind attention.
Thank you so much,
Thank you
sir.
so much, sir, for gracing us with your presence and for making sure that the troubles that you went through, we don't have to go through the same troubles. We really appreciate your time and your efforts, sir. Thank you so much. I think we had to cut short Dr. Iqbal's present. We didn't cut short, but there's a lot of questions. So if Dr. Iqbal, you could come on again, please. We'd like to ask a couple more questions, if that's okay, if you still have the time.
Sure.
So one of the questions is, one of the students wants to know, even though you elaborated this already, but he wants to know whether if you could give them an example regarding evidence-based learning.
Yeah, that was my last two slides, but due to time restraints,
Yeah.
if Mr. Adil, my young fellow, couldn't mind it, so I will present those two slides, because these were basically putting the theory into the clinical practice. So, but I was aware that my time bar is 10 to 12 minutes. So, with your kind permission, I will give you this example for each and everyone. So, is there permission from Mr. Adil?
Sure, absolutely.
Yeah, thank you so much. Mm.
Sir, only 3 minutes. Dr. Iqbal, we only have 3 minutes.
Yeah,
So
I will complete it in 2 minutes, inshallah.
perfect. Perfect. I'm sorry for that, but thank you.
Actually, I will give you an example. Last Sunday, when I went to my village, a lady visited me. She was 67-year-old, and she was a patient of heart failure, and she was taking lisinopril and other medication along with statins. My screen visible to everyone?
Yes, sir. We can see
Okay.
your PowerPoint presentation.
I'm just that lady. Actually, she want to spend a few weeks with her son, who is living in Karachi, and she want to visit her. But she was concerned that I'm taking these medications, so it will be very odd if she develops some symptomatology there, and she went into heart failure, and that needs special hospitalization. She wants to not to be hospitalized. So she visited me and told me, look, doctor, زه خپل مور پلار د خپل زوی څخه زما او سدسي چلو که چې ماته هسپتال ته د تلو ضرورت را نشي. So this is basically a dead scenario. So this slide, hopefully you are seeing the slide of example for evidence-based application. So when I evaluated her as a doctor, I was of the opinion that she should be on digoxin. But digoxin, as you all know, is a medication which needs regular medical supervision. So uh, I'm putting this question for you, that let's have a search on this question, so that next time she present to you, what will be your advice. So this PICO approach is, the patient problem is congestive heart failure, and she's an elderly lady. The intervention in this case is whether to give digoxin or not to give digoxin, and comparison in this case will be either not to give digoxin or to compare with a placebo. And the outcome may be in terms of primary outcome to reduce the need for hospitalization, and the secondary will be to reduce the mortality. So uh, what kind of answerable question it can be? I hope put it into this term: an elderly patient with congestive heart failure, is digoxin effective in reducing the need for hospitalization? If you concentrate on this question, it's basically a therapy question. And I already told you, for therapy question, the best evidence will be, level of evidence will be randomized control clinical trial. So now use a search engine, and we have chosen Medline as our resource. As you all know, Medline is the most comprehensive resource, and you can access the articles from the Medline through PubMed. So whenever you write your question and apply the Boolean words and filter this search by typing a study methodology, different levels of options will be available to you: either no design study, or primary studies, or experimental studies, or secondary pre-appraisal, or guideline studies. So with this simple approach, you can apply this thing into your clinical practice. So hope that the question is now clear to each of you.
Yes, sir.
Yes.
Thank you so much, sir.
Thank you so much, sir. And we really apologize that we had a time constraint. There's a reality to every situation, and this is our reality. So, but
Yeah, I
thank you
can
so much.
understand.
Thank you so much for your time, sir. We really appreciate you joining us. And this was a very informative session for me and for the audience as well. Thank you so much again, sir.
Thank you.
Hope to
God
see you
bless you.
again.
Khuda Hafiz.
Allah Hafiz. Stay with us. We have to continue.
Apart from this, if there is any question, you can send me to Mr. through Mr. Asad and my daughter Rofaida. You can send it through their correspondence, and I will be delighted to give you feedback and that. And if any kind of research help from my side is needed, I'm more than ready to help you, rather than to get enlighten myself with the new minds and new perspectives and new ideas. So God bless you all. Stay blessed. Take care of. Good evening. Khuda
Jazakallah.
Hafiz.
Allah Hafiz. Now I'm requesting the audience to please be a little bit patient. We have run out of time on the first Google Meet, so we'll be switching to another Google Meet. I will keep you posted on that. Um, in the meanwhile, let me tell all the audience that please, all the audience, please note that we've sent you, so the emails that you used to register for the webinar, we've sent you a Google form on those email addresses. So please kindly fill those up. You'll have 15 minutes after the webinar ends to fill them up and submit them. And so those will be needed for us to generate online certificates for you. He will elaborate on his topic, and then we will wrap it up. Can you hear us, Adil?
Hello?
Can you hear us?
Yes, I'm just trying to present my screen here at the moment.
Perfect, Adil. We can see your screen and we can hear you loud and clear, so please, you may begin.
Okay. Assalamu alaikum, everyone. I know we're short on time, so I'll keep this kind of quick. My name is Adil Khan, and I am a fourth-year student at Khyber Medical College, as well as the Vice President of the Student Research Committee. I'm honored to be here today to discuss how to create a successful research culture, which is the framework for how we conduct research, not what's in research, but exactly how we conduct it. And this is going to be important for you in medical school as well as for the rest of your careers as physicians. Here are the basic aspects of the presentation I want to give to you today. These are the basically 6 points of creating a successful research culture. We have relentless collaboration, meaningful impact, authentic feedback, fearless generosity, accountable mentoring, and work fun integration. Am I still presenting? Okay, good. Sorry.
Yes, just ask him to open his presentation from the taskbar down here.
Adil, open your presentation from the taskbar.
Down here. Down.
Start bar at the bottom.
Oh, there we go.
Click that up.
We're good now. Yeah.
Yep.
We're good.
Okay, so to begin with, we have relentless collaboration. Basically, it is the so basically most significant research is multidimensional, intersecting different fields to reach common goals. Basically, what I mean is to solve bigger problems. We cannot look at specific specialties, but rather combine multiple fields of work. So, for example, in a research group, we would have, you know, a surgeon, a statistician, environmentalist, etc., just to show multiple viewpoints of what exactly we want to, you know, investigate. So we enforced this relentless collaboration by inviting collaborators from other fields to join projects, keeping open communication between members and interacting in their environments as well. So for example, like colleagues in different medical specialties, different careers. So like I said earlier, if one member is a cardiologist, another member, we'd have a gynecologist, another, member is a surgeon, or even on a grander scheme, we have one member who's a surgeon, one who's an economist, one's a sociologist, one's a general practitioner, just so we can look at different viewpoints. The next we have is meaningful impact. So going off on collaboration, we want to pursue high impact questions for research and avoid one-off specific projects. So basically what I mean here is that we want to focus on bigger picture questions and how we can, impact a greater population rather than looking at a specific cohort. So again, example, if we were to do research, we would focus more instead of, let's say, cardio specific research, we would focus on general healthcare. And we enforce, meaningful impact by encouraging researchers to think bigger than their own fields of interest. Again, so me, I'm interested in general surgery, but if I was to want to do research, I would focus maybe, cardiology or just something broader than what I'm specifically interested, just so I can get a greater viewpoint on what's going on around me. Obviously, draw out each individual's passions and finding the questions with the most impact in that area. And then the last thing is narrative development. So narrative development is essentially we identify a problem or idea to explore. Then you find somebody that you can learn about that problem or idea from, and then you collect other data from different field texts on that same problem. So if I'm, curious about something in cardiology, I'll go ask a cardiologist about this problem. And then I will also go to, different fields of work and ask about maybe there's the same problem happening in their field as well. Then I take all that information I learned from, everybody, and then I retell that story using all the information collected, and that's how you develop a good narrative. Okay, third, authentic feedback. Honest feedback and openness to constructive criticism are essential to producing high quality work. We should understand how to give feedback and receive it. We should flatten hierarchies and lower threshold for bidirectional feedback. So what I mean by that is, for example, if I'm writing a research paper on biochemistry, in a pure research setting, I should be able to go to the HOD of biochemistry and ask him if he can give me, solid feedback on my, research. And I shouldn't have to be, shy, or I shouldn't have to be worried that, what is the HOD of biochemistry going to think about, my opinions, and vice versa, right? If the HOD of biochemistry is writing a research paper and he knows I'm interested in research, he should be able to come to me as well and ask for authentic feedback. That's what I meant by bidirectional feedback and flattening those hierarchies, where in research we want to create everyone as equal. And we enforce authentic feedback by ask for regular feedback beginning early on in your project. Focus on improvement over criticism. Basically, one of these methods I like to use when I give feedback is called the sandwich method. Basically, if someone gives me their research and I want to give them feedback, I'll start with one positive thing I liked about the research. Then I'll give them a suggestion on how they should fix something that I saw maybe could use work. And then finally, I would give them, another positive ending, just to show that I really did enjoy their research, and it gives the the person receiving the feedback the understanding that, okay, there is some work they can do, but overall, they're on the right track, and they're going in the right direction. And then finally, we want to focus the feedback on the individual and their self-improvement instead of making comparisons. So if I'm giving feedback, let's say somebody gives me their research, in their first week that they're working on it, and there's, several things they need to change. And then, 5 weeks later, they give me the same research and, it's significantly improvement. I'm not going to say, oh, so and so research is a lot more detailed than this or something. I would come to them and say, your research has improved so much since the beginning, and here are additional things you can work on, just to create that friendly environment where you're comfortable giving and receiving feedback. Right, in research you really have to put your ego aside, and you can't let any of those things get in the way. The next thing we have is fearless generosity. So because feedback and review are so valuable, we should generously lend our time and expertise. So basically in research, we want to have this abundance mentality, meaning that there's enough room for everyone to be successful, and we share responsibility for each other's growth and success. So what I mean by that is, in this research culture that we have now at our medical college, hopefully it expands and grows, inshallah. But when I, am working on a research paper and somebody else is also working on research, um, I shouldn't deter from their research by, cutting them down or making them feel bad about, what they need to work on or something like this, because they're also my colleagues. So at the end of the day, I'm also responsible for the success and growth of their research, as well as I would expect the same from everybody else. So we enforce this fearless generosity by being open about our publications and current projects. For example, I have multiple open projects right now, and I have some previous publications. And I have, there's a website called ResearchGate where you can go on there and basically upload all your research for everybody to see. And then you can also have transparent discussions at the start to define roles and responsibilities and expectations. Basically, if you're going to start a research project with a group of members, you want to let them know what their role is, what their expectations are of them, what they should and what they shouldn't be doing. In the same way, if you're bringing on a new, should we have already started, when you levels is authorship, am I first author, second author, third author? So that's one thing that you should always, say in the beginning, just so people don't, feel cheated or anything like that. And obviously, we want to create equality and inclusivity and fairness all working together, and offer anyone with the desire to participate the opportunity to contribute and join project teams. That's obviously the inclusivity. The next we have is accountable mentorship. Depending on our upcoming schedule in our own college and the Student Research Committee, we have discussed that we would be implementing a mentorship program to link students with similar interests on projects with someone who has experience in that. So basically, one thing I'd like all of you to do is after this webinar, if you are interested in research, take the time to write down 3 to 5 goals you have related to research. Whether it's be you want this many publications, you want to collaborate on this many papers, or you want to work with a specific person at the hospital or another student or a professor or whatever. Write down specific goals that you have, 3 to 5, that you're comfortable sharing with somebody else, who you would consider your mentor, and you share with them so they can kind of see if they can help you accomplish any of those goals, right? And it's good to have those goals written out so you have a clear idea why you want to do research and what your final end goal is. Another way we have is to enforce this is regular meetings with the mentor and the mentee to ensure open communication. And obviously the mentor is responsible for offering their full support for goals and direction. And just to say, mentors can be anyone, right? It doesn't really matter if they're your junior or their senior. Just for example, I'm mentoring a final year student, and just that also goes into breaking down those bi-directional feedback and breaking down the hierarchies. where, I don't consider this person, above me. They don't consider themselves, I'm below them, or however, we're at the same level, and we're helping each other accomplish our goals together. And last but not least, I have probably one of the most important, I consider, aspects of conducting research is that you're having fun. So basically, at the end of the day, research for me is a way to obviously hone in on certain topics I've learned in class, or really go after my passions. But as a big thing, it's for me to have fun and kind of have an understanding of things going on, outside the classroom. So I definitely believe that you'll achieve more if you're having fun along the way, and you'll definitely stay committed. So we enforce this kind of pillar by learning to laugh at yourself and celebrate your quirks, right? Be whoever you are unapologetically, always, right? Don't feel that you have the need to conform to other students or to, what's going on in the college. Just be who you are, whatever you're feeling on the inside, project that to the outside. And, along the line, somebody will, pick up on that, and they'll enjoy you for you instead of who you're trying to be. Okay. Another thing is we can openly share humorous stories of mishaps and use them to make teaching points. So, for example, I was working on a meta-analysis, and we had to basically look through 15,000 different papers and see which research fits into our own research. And so 15,000 is quite a bit. So I was working on this kind of late at night, and I ended up falling asleep on my laptop, and I lost all the information, all the work I'd done a day. I think about like 3,500 papers I'd looked through, and I lost all of it. So I use that as a teaching point to say, well, don't work on these things when you're tired. Don't do these things late at night. Do these when you're refreshed. Get some good sleep. Obviously, we're medical students, so it's a little bit difficult. I would say towards the chai pilo and come back and do it again. So yeah, just my last takeaway points are basically collaboration is the new competition. So what I mean by that is, there's a good quote I like to use here, is that if you want to go fast, go alone. But if you want to go far, go together. So I truly believe that if you're working with other students, if you're working, together, you'll go much further. You'll achieve, so much more. You'll have fun along the way. Than if you're looking at everybody else as, a competitor, and I can't share this with you. I don't want you to work with me, and, my loss is your gain. That mentality doesn't really work in research. You have to, be willing to work with others, see your colleagues as resources rather than, somebody taking away from your success. Another thing is focus on the bigger picture when asking the research questions, right? Again, we don't want to, focus on a very specific population. We want to see if this research can be reproducible in different populations. We want to kind of solve, the larger questions presented to us in medical research. Next, obviously, flatten hierarchies and seek improvement over criticism. And then, the next, equality, inclusivity, and fairness, all keep those together. The next is to know your goals. Like I said, write down 3 to 5 different goals you have, and do feel comfortable presenting them to somebody. And obviously, at the end, have fun. That's probably the most important part of this entire, everything we're doing here, so you can have some fun. So yeah, I hope you guys picked up a thing or two that you will implement in your own research moving forward. And again, thank you guys for having me. Jazakallah.
Thank you so much, Adil.
Thank you so much, Adil, for giving us your valuable time. I'd like to thank everyone who joined us today. We could not have done this without you. I'd also like to remind you all to fill in the Google form we've sent you so we can send you your certificates. We'll be closing the form 15 minutes after this webinar is finished. And please follow our Facebook and our Instagram pages so you can stay updated on our activities and contact us if you need to.
Okay, you can call them. As we conclude today's webinar, I'd like to thank our guest speakers for their valued time and for educating us on such pertinent topics. I'd also like to thank Mr. Suleiman, who you can't see right now because he's on the other side of the camera.
Thank you.
You're welcome, sir. We'd also like to thank Dr. Bushra, the Associate Dean for Research, Khyber Medical College. And finally, I'd like to thank the members of the Student Research Committee.
Our wonderful team.
Our wonderful team behind us, if you can see them. Without you guys, this would not have been possible. So thank you so much. Thank you so much for all those who attended. Please make sure to fill out the form so we can send you the participation certificates. We hope to see you all soon. Take care. Wassalam.
Thank you so much.